Hi, I'm Dr. David Jack. I'm an aesthetic doctor. I've got a clinic on Harley Street, and today I wanted to talk to you about botulinum toxin, which is a medical product that has been around for at least 30 years, developed initially for things like squints and migraines, and now has over 900 different medical uses. And you've probably heard of this because it's used very commonly for anti-wrinkle injections, particularly treating areas such as crow's feet, frown lines, and forehead lines. So today I just wanted to go over some of the other uses of botulinum toxin in the face, and go through some of the kind of more alternative applications of this treatment. You might have heard of botulinum toxin being described as Botox, which is one of the brands of botulinum toxin. There's a few different brands using very similar molecule. Things like Dysport, Bocature, Xeomin all use a type of botulinum toxin which is derived from the same thing. So firstly, Botox can be used, or toxin can be used in the bunny lines in the nose. So these little kind of scrunchy lines that you get here that are caused by a muscle that runs along the side of the nose. So putting a little bit of toxin in here can help just relax that muscle and make these lines appear slightly softer. The other thing it can be used for in the face is in the chin. So sometimes with aging and volume loss in the chin, you get a line developing here and also a kind of orange peel texture to the chin. So toxin can be used to reduce the tone of the muscle that is quite superficial in the skin there and soften the chin, which can give quite a nice smooth appearance. Another area in the face that you can use toxins is in the masseter muscles, which are the big muscles at the side of the face, which are muscles that are there to help you chew. It's one of 4 muscles that you use to chew. But sometimes over time, what can happen to these muscles is that they can become quite bulky and enlarged, which creates a kind of square appearance to the face. So aesthetically, what you can do is use a dose of Botox in these muscles, and it slightly wastes the muscle away to slim the face and improve the jawline contour. So that's quite a popular treatment for toxins. Also has the effect of reducing the tone of this muscle so that you might grind the teeth a bit less. So if you're getting jaw pain or grinding when you're asleep at night, this might be a treatment to consider. So another area in the middle of the face that can be treated with toxin is the upper lip. So if you've got very fine lines above the lips, sometimes it helps with that. But the main thing that people seem to be asking for now is the Toxin Lip Flip, which is where you inject little tiny doses of toxin along the upper lip, which actually turns the lip out ever so slightly, which gives an appearance of volumization of the lip. So it's kind of an alternative to dermal fillers if you're worried about this. Some people it works in, other people it doesn't. But the only issue with this treatment really is if the dose is slightly too high, it can affect the way that you say certain consonants. For example, saying S or drinking from a straw. So that's something to bear in mind when you're doing this treatment. The other toxin treatment for this area is also to treat Gummy Smile, which is that if you smile and you see a lot of the gum when you're smiling, a dose of toxin above the lip in this area here can sometimes drop that down ever so slightly just to decrease the appearance of the gum when you're smiling. So that is probably one of the most popular treatments for this area. Another area is the neck. So in people as you age, you tend to get these bands developing on the neck, which are caused by a muscle that's very superficial in the skin called the platysma. And if you use little doses of Botox all the way along these bands, sometimes it can have a softening effect on these bands, and also you can get a little bit of lifting of the jawline. So this is also very popular, and it's sometimes called the Nefertiti lift. Another target that botulinum toxin works on is the sweat glands and sebaceous glands in the skin, which are basically the pores. So when you inject very tiny doses of toxin very superficially in the skin, what can happen is you can reduce sweating a bit, so it can treat hyperhidrosis or excessive sweating in the face, but it also decreases oil production in the face. So for enlarged pores, it can really help with this too. And you would just do very tiny doses on the face, or particularly on the nose. Some people find that they get really engorged, oversized glands on their nose, so it can help with that too.